Thank you, Mr. Chair. And I'm guessing that perhaps that heightened anticipation for this presentation, we'll see. So again, our purpose today is really just to provide a work in progress update on the CSWB initiatives and specifically the action tables that have been formed. If I could ask the team to move us along to slide number 2, please. So just a very brief reminder that our CSWB plan is really a collective impact model that brings together partners from the health sector, from education, from municipal government, in order to collaboratively understand, research, and respond to community needs. And we sometimes refer to it as noted here as a multi-sector collaboration. It's really a crucial success is the system leadership group. And we've been really pleased that all of the organizations that are partnering in our CSWB plan have made their senior officials, meaning Chief Tanner, meaning Jane McCaskill, meaning CAOs of our 2 hospitals and Ontario health teams, superintendents of education by way of example, all participating at the system leadership group in providing that executive direction and oversight to all of the activities. An important component, though, beyond the executive oversight is the establishment of action tables. And these action tables bring together the people, programs, and services that are best positioned to respond to specific issues. We have had I believe, over 60 community agencies and organizations participate in the variety of action tables that I will give you an orientation to today. So it's perhaps worth remembering that the model is really an inclusive one that brings together a significant portion of the human service sector across all of Halton Region. We are mandated to have in place a community safety and wellbeing plan under the Police Services Act, and certainly we are compliant with that expectation. And I think it's fair to say that Halton Region and Halton Regional Council and the Police Services Board are seen as leaders in the approach to community safety and wellbeing. We work with our partners at the Ministry of Solicitor General and other municipalities to profile our work and to support other jurisdictions who are perhaps just getting started in their efforts to establish a plan. If I could take us along to slide 3, please. So in fact, at this juncture, we have now 10 action tables formed. And you can see on this slide, I won't speak to each of them, that there is a breadth of activity and a breadth of topics and areas of attention in the community that are being dealt with. These tables are at different levels of momentum, and I think some have been established now for some 18 months and are much more advanced in terms of aggregating data around their particular issue, bringing together partners to establish new ways of delivering service and supporting particular populations, and in fact have been recipients of investment to support their activities. Other tables, by way of example, are a bit new. So the process is organic and is open-ended and allows us to be nimble and to respond to issues as they emerge, to spend the time that we need to attack large systemic problems. I think that is really the strength of our CSWB model. I think it's fair to say that the COVID-19 pandemic has impacted the work of some of these action tables, and we've needed to modify some of the approaches to change service delivery that were under consideration, recognizing some of the demands of public health guidance. If I could take us to slide 4, please. I'll just pick out a couple of action table highlights because I think an important consideration is, well, what's really changing? What action is being taken? What material impacts are there on citizens, on communities? This just gives you a sense of within the action table some of the specific outcomes and outputs that have occurred. So you'll note here that we've worked with a variety of agencies in the child and youth mental health sector. And with the leadership of the Reach Out Center for Kids, a new model of access and system navigation for families seeking that service has been established. And in fact, that coordinated model now reflects 22 separate programs being brought really in under one intake and navigation model. On our homelessness action table, we've significantly strengthened the coordination of a variety of providers in this space. And these organizations have worked together, as noted here, to establish 70 offers of housing through this new framework, and we're seeing significantly improved coordination across all organizations. In the middle sphere here, you can see that an action table did develop recommendations that would enhance support to survivors of sexual assault in HRPS, and an impressive 800 frontline officers have been trained on procedures and protocols related to that support. I wanted to flag as well that we've worked closely with a number of organizations, but specifically Halton Children's Aid Society, to support older youth who are exiting the care of children's aid societies. And I think it would be fair to say these are individuals without the same family and social supports that many young people enjoy. And we've established an education, training, employment, and mentorship program for youth. And we've now, at this juncture, been able to support 26 youth in that circumstance with these enhanced supports. And then lastly, as is noted here, we've worked with these action tables where they have investment-ready proposals. And we've leveraged the Halton Region's Community Investment Fund to support their work, over $500,000 of direct investment in action tables to date. If I could ask us to move along to slide number 5, please. So an important component of our overall plan is an ability to measure and determine the impact of the solutions and programs that we are putting in place. And we have previously reported to Council that we've developed a population level indicator framework. And you can see the image on the right-hand side of slide 5. There is a detailed 2020 population level indicator report available on halton.ca. And this is the result of an important component of the plan, which is our data and decision support. So that brings together all of our key players, including other organizations that have an interest or access to data around human services and human service needs. It ensures that the work of the action tables are based in evidence and local context. It allows us to best identify issues and emerging trends using data. And as I alluded to off the top, it will allow us over time to demonstrate trend and change and impact of our efforts. So I do encourage council members to have a look at the population level indicator report. The next slide, slide number 6, if we can move there, please, gives you a bit of a snapshot of the types of indicators that are present in the report and that are being tracked on an ongoing basis. But they are across the 3 important domains, obviously, of health, safety, and community well-being. And again, there are more indicators present in our model than are depicted here. And we've made an effort to use data that is well established, that is already tracked through other mechanisms and has a richness to it and a veracity to it, so that we have a high level of comfort that these are data points and indicators that we can appropriately use. If I can, I'll move us along quickly to slide 7, please. And I mentioned briefly earlier that we've sought a tighter alignment between our CSWB plan and the region's community investment fund. And I think we've made significant progress here. Regional Council has now approved approximately $3 million in annual funding under the Community Investment Fund. And I must say, this is a really crucial lever that allows us to make smart investment decisions in new approaches to service, pilot approaches, prototypes that are emerging from our action tables. And it really is important when we're working with relatively small and small community agencies that have limited resources. Our ability to provide some seed funding to the work has been crucial to advancing our efforts. We work very closely with the system leadership group, again, that executive committee for the plan, as we make decisions around community investment grants. And we've, I'd say, fully embedded the logic of community safety and well-being in our granting programs. So those 3 domains of health, safety, and community well-being are at the heart of the decisions that we're making when we are granting funds. And as I alluded to earlier, over $500,000 of the Community Investment Fund has been directly tied to the work of specific action tables, but more generally, I would say the entire thrust of our investment fund granting is in full alignment with community safety and well-being priorities. So at this juncture, I'm going to turn the floor over to Constable Kris Elliot from Halton Regional Police Services. Constable Elliot is a really crucial leader at our situation table that deals with individuals in circumstances of highly advanced risk, and he'll be a little bit of an update on that particular component of our plan. Thank you.
Thank you, Commissioner. Good morning, everyone. As introduced, my name is Kris Elliot. I'm Constable with Halton Regional Police Service. Really quick, I'd just like to thank Deputy Wilkie and Commissioner Sarchuk for the opportunity to provide this update. This is a community table, the situation table, and they, again, work very hard to provide support and care, as we'll discuss very briefly here. And I do this on behalf of the table, which is, as I say, a community table. So thank you for the opportunity to pass on this information. If we could switch to the next slide, please. So as you may be aware of, the Halton Situation Table was established in 2013. We currently sit at over 30 community partners that meet weekly to mitigate risk, situations of acutely elevated risk. We utilize the filter process as displayed on the screen to ensure that proper confidentiality and sharing of information is done to provide the utmost respect and care and holistic kind of intervention possible. We, as a table, moved to virtual meetings like this one. And I have to say the response was great. We were one of the first to do it in all of Ontario in our community of practice. Many tables carried on after we experimented with it for a couple of weeks. And we have, on average now, 37 community partners log on every Tuesday morning for the meeting. So the response has been great for the cases that are being presented. Switch to the next slide. So here's a quick snapshot just of what we're seeing at the Halton Situation Table. So year to date, we've had 53 situations that have been presented at the table. As I mentioned, we meet every Tuesday, 9 a.m. So 53 of them so far, compared to last year where we had 49. So we are on the upward swing of an increase of situations. Of the 49 that were presented last year, there's 53 this year and 40 that met acutely elevated risk in 2019. So we've seen a 23% increase year to date. And then the graph on the right, I just wanted to capture just because of the increase at the table this year. It shows kind of in the COVID period between March and year to date, we've had a 90% increase in our situations come across the table. And that could be for a vast amount of reasons, but mainly we are seeing a lot more acuity and a lot more individuals that have become at risk and require an immediate response. You can switch to the next slide, please. Just to capture again the top risk factors of what we're seeing at the Halton Situation Table. So we do use the risk tracking database, which is supplied to us by the Solicitor General's Office. And they provide us with kind of a guideline of what risk activity that we capture. So in every situation year to date so far, we've had mental health and cognitive functioning come up. There's a vast amount of subcategories that fall under these risk categories. However, these are the top 10 that we are seeing on a regular basis. I did a presentation to the system leadership group in March, and even between March and now, we've seen a slight variance in the top 10. We've seen that physical health has come out of the lower of the top 10 and moved up to our top 5. And again, that can be all related to what we're seeing with regards to the pandemic. Next slide. And really quick, the table actually asked for this to be presented, but they wanted to provide you folks with kind of an idea of just what we are dealing with. And very briefly, I'll just give an example of a scenario that we just recently dealt with. The risk factors that are identified were mental health, housing, and physical health. And to give the very Coles notes and keeping confidentiality in mind, a case was presented at the table in the last couple of weeks of a person that resides in Halton region. They live in an apartment above a very actually well-known restaurant in the region, and the person had multiple physical health diagnoses. One of them had progressed to the point where he couldn't walk and he had limited dexterity in both of his hands. And emergency medical services were called 18 times in a very small period of time to pick him up and assist him with some daily living issues. He had not left his home, it's believed, in the last 2 years. So COVID had definitely exacerbated this situation. And in the last 6 weeks, he had been using multiple services, including our emergency department, emergency medical services, police, and other community agencies for assistance. The conditions were reported deplorable and filthy in the house, and there was a question of the subject's ability to care for oneself. So a community partner brought this forward to the table Tuesday morning at 9 a.m. It was presented in a well-articulated way to which the situation table deemed this individual acutely elevated. At that point, just to add, there was 37 community partners present, to which some of them receive HRCF funding to provide their support to the situation table. So just to speak of the testament of the importance of that funding. Upon receiving AER status within 27 hours, the subject received the following: face-to-face with a community mobilization officer and a mental health worker. Consent was obtained and introduction to services was completed. A care conference was called within the hospital and was able to provide a fulsome report, including pictures of the conditions to which this individual was living. A plan for medical assessment was made. Coordination of a apprehension was completed with emergency medical services, and then safety planning was commenced, which included fire safety planning of the residents because there was evidence of misuse of cigarettes and burns throughout the residence. Housing assistance was provided. Care aids for daily living have been arranged, and assistance with the cleaning of the building. There's no doubt in the minds of everyone that sit around the table that the situation table had a big part in the intervention of this individual, and the subject's health would have continued to decline to the point where his life would have been in jeopardy. He is now thriving a couple of weeks later with increased supports, and there is plan to discharge into a safe environment utilizing some Halton housing. Just wanted to pass on this example of a story. We've had numerous exactly like this. There's many individuals that are working extremely hard to assist individuals such as this subject in Halton. And I thank you very much for your continued support, and appreciate the chance to update you all.
Mr. Chair, that'll conclude our presentation today, and we're very pleased to answer any questions from council.